global revenue in the oral care industry is projected to soar to an impressive $53.14 billion by 2024. This significant growth is primarily attributed to the rising prevalence of oral health issues, with gum bleeding being a predominant one. The worst part is that a considerable portion of the population overlooks the underlying causes of gum bleeding, neglecting the importance of seeking professional advice and treatment. But sometimes symptoms can be misinterpreted, so let's try to understand the main causes of gum bleeding that you probably can avoid. 1. Gingivitis. One of the most common reasons gums bleed is because of gingivitis, which happens when plaque builds up along the gum line and isn't properly cleaned off. But the good news is, it's reversible with treatment at your dental clinic. The main culprit behind gingivitis is not taking good care of your teeth and gums. If you don't deal with it, gingivitis can get worse and turn into full-blown gum disease. But don't worry, if you catch it early and get it treated, you can prevent that from happening. If your dentist tells you that you've got gingivitis, it's important to know that it can mess with other health conditions too. For example, folks with diabetes are more likely to get gum disease because their wounds heal slower. Plus, there's growing evidence showing that gum disease might up your chances of getting diabetes. And getting proper gum treatment can actually help control diabetes better. And that's not all. Gum disease might also be linked to serious stuff like heart disease and stroke. So taking care of your gums isn't just about your smile, it's about your whole body. Improper flossing technique. If your gums bleed after flossing, and they have never bled before, the flossing itself could be the cause. If you took a few days off from flossing or increased how often you floss, you might notice minor gum bleeding. This gum bleeding should stop on its own after a couple of flossing sessions. If your gums bleed frequently, or every time you floss, visit your dentist. There might be a bigger problem out there. To floss properly, be sure to glide the floss with a gentle rubbing motion and curve the floss into a C shape to wrap around each tooth. Avoid snapping the floss into your gums, which can cause gum irritation and make gums bleed. Switching to a new toothbrush. Switching to a new type of toothbrush, especially if it's got harder bristles, can also trigger gum bleeding. It's like your gums are asking you to ease up a bit. Most dentists actually recommend soft-bristled toothbrushes because they're gentler on your gums. Sometimes, though, bleeding gums happen because you're brushing too hard. While it's okay to brush with some gusto, you really only need a good 2 minutes to get your teeth clean. And remember, it's smart to swap out your toothbrush every 3 to 4 months, especially if you notice the bristles starting to fray, which can irritate your gums even more. Poor diet. Eating processed foods with certain ingredients can also irritate your gums and lead to bleeding. For instance, starchy foods can stick between your teeth and turn into sugar, which can build up plaque and inflame your gums, causing bleeding and even decay. To avoid this, try swapping processed foods for healthier options. Good nutrition is key to oral health, providing the vitamins and nutrients your smile needs from the inside. Focus on fruits, veggies, and foods packed with calcium, vitamin C and D, and magnesium to maintain good oral hygiene. Serious health conditions. Bleeding gums might seem like a minor annoyance, but they could be your body's way of waving a red flag for some serious health issues lurking beneath the surface. Take diabetes, for instance. It's like the sneaky saboteur of your immune system, weakening its defenses against infections. This puts you at a higher risk of gum disease that can leave your gums swollen and bleeding. And to add insult to injury, those pesky high blood sugar levels in diabetes, they slow down your body's natural healing process, making it even harder to kick gum issues to the curb. Then there's leukemia, the tough opponent on the cancer battlefield. It doesn't just mess with your blood, it messes with your body's ability to stop bleeding altogether. So your gums might keep bleeding, making it seem like you're in a never-ending dental horror movie. But wait, there's more. Ever heard of vitamins C and K? They're like the dynamic duo of gum health. Vitamin C swoops in to help heal wounds and fortify your teeth and bones. Meanwhile, vitamin K ensures your blood clots properly, preventing excessive bleeding. But if you're running low on these essential vitamins, your gums might start to resemble a leaky faucet. So next time your gums start bleeding, don't just shrug it off as a minor inconvenience. It could be your body's way of hinting at bigger health concerns lurking beneath the surface. And if you want more helpful health tips, be sure to subscribe to Natural Education and become part of our YouTube family. Medications. Surprisingly, certain medications can make your gums more sensitive or prone to bleeding. Blood thinners, for instance, reduce clotting and can up the risk of bleeding, including in your gums. Other meds like aspirin, birth control pills, NSAIDs, and certain blood pressure medications can also heighten the chance of bleeding gums. It's important to inform your dentist about any new medications you're taking, particularly if your gums are bleeding frequently. This allows them to identify any oral health issues and adjust your oral care routine if needed. Smoking or vaping. Decades of research have shown the harmful effects of smoking on dental health. And now, experts are raising concerns about vaping too. Both smoking and vaping can lead to a decline in dental health, including bleeding gums. Using cigarettes, tobacco products, and vaping can cause bad breath, yellow teeth, and gum disease. The longer you use these products, the greater the risk to your dental health. Tobacco-containing products increase your chances of cavities and sensitive gums, leading to bleeding gums and tooth loss. That's why quitting smoking or vaping is the best way to prevent bleeding gums and tooth loss. While it may be challenging, the benefits of quitting are substantial. Speak with your doctor to explore safe and effective methods for quitting smoking and vaping, so you can enjoy a smoke and vape-free life. Trust me, it's worth it. Poor diet and vitamin deficiencies. Your diet has a big impact on your dental health. Foods high in sugar and starch can build up plaque, leading to cavities and bleeding gums. While you can treat yourself to sweets occasionally, it's essential to limit these foods and brush your teeth afterward. But eating well isn't just about cutting back on unhealthy foods. Bleeding gums can also be linked to vitamin deficiencies. To keep your gums healthy, include whole foods like vegetables and fruits in your diet. These foods are packed with essential vitamins and minerals that can lower your risk of bleeding gums and promote overall health. Pregnancy gingivitis. Pregnant women often face a higher risk of gingivitis, with around 60 to 75% experiencing this dental problem. Hormonal changes during pregnancy can lead to an exaggerated response to plaque on the gums, resulting in swollen, painful, or bleeding gums, as per the American Dental Association. To maintain a healthy smile during pregnancy, you may need to adjust your oral hygiene routine. It's essential to prioritize proper dental care, especially when your gums are more prone to bleeding. Besides taking care of your dental health and treating the underlying causes of gum bleeding, there are a few additional tips to help treat it. You can try rinsing with hydrogen peroxide, which helps eliminate plaque and promotes healthy gums. If you don't have hydrogen peroxide, warm salt water can also reduce bacteria in the gums and provide relief. Applying a cold compress after rinsing can further help by reducing blood flow to the gums. Another quick fix you can find in your kitchen is green tea. Drinking green tea daily can ease gum bleeding because it contains a natural antioxidant called catechin, which helps reduce inflammation caused by bacteria in the mouth. So give these simple home remedies a try to soothe your bleeding gums and promote oral health. And if you're diabetic, it's essential to manage your sugar levels to minimize risks. And if you're someone dealing with sugar levels or have high glucose levels, this video about the most important supplements for your blood sugar would really help you out.